Uganda twagala, the Uganda we want. Nze Mulanzi Robert okubuuzaako n'okwebaza emirimu gy'okola gwe atulaba eyimira ku Dream TV kyamaanyi. Batugoberera ku mutimbagano gwaffe www.imc.ug webale. Well, having said that, let's go into the Uganda we want. Today we are honored to host Dr. Faith Nabushawo. She's a medical doctor, and of course they have their specialization, if I may call it that way, but she's now a general doctor practitioner. Well, and also she's a leader because she's a Deputy Secretary General of the Uganda Medical Association, and she's a teaching assistant at Caesar King University. We are glad and privileged to host you, Dr. Faith. May you please greet our viewers.
First, thank you. I would love to thank you, Mr. Mulanzi and Dream TV at large for hosting me. It's such a privilege, and I must say I feel honored to be here today and at this particular hour on this program. My name is Faith Nabushawo. Like he has mentioned, medical doctor, general practitioner at the moment. Okay. Yes. Also a teaching assistant at King Caesar University, where I do some teaching.
Is it King Caesar, Caesar King?
It is King Caesar University. Yes. Okay. Yeah, so I also teach at King Caesar University, and as I practice medicine, along the way. Just something small about me. I'm a born of Mbale, Bududa district. Hey. I'm born of.
How do we greet in Mbale, in Lugisu?
We say kama huwa mlembe.
Kama huwa
mlembe. So I'm born of Bududa district. I hail from Bududa. I've studied my primary in Mbale. I was at Nabionga Primary School. After that, I went to Hamdan Girls High School, where I spent the whole 6 years of my high school.
Wow. So you spent 13 years in only 2 schools. The first
Yes.
7?
Yes.
Okay. And in one school, and the other 6 in one school.
Yes,
wow,
yes.
That's good.
Yeah, so from Hamdan Girls, I joined Kampala International University. Okay. That is the Western Campus in Bushenyi, where I studied a bachelor's in medicine and surgery, after which I done my internship in Mulago, and currently I do the teaching at King Caesar University while I do the medical practice.
How did you get into the Uganda Medical Association leadership? Because as we speak now, you're the Deputy Secretary General, and recently you've had, normally here in Uganda we say saga. You had the leadership saga, where you had to change your leadership after one of after your president tried to compromise his office, and then I saw you bringing in the vice chairperson by then, Dr. Naku Edith. I think she's now the president of Uganda Medical Association. But how did you get into the Uganda Medical Association leadership?
Well, thank you so much. It's a good question. How I get into the leadership of the Uganda Medical Association is because I am a leader, and I have been a leader all my life. I've led students at the university. I held various leadership positions, and my leadership into Uganda Medical Association started with me being the Secretary General of the Federation for Uganda Medical Interns. At that time, as the Secretary General of the Uganda Medical Interns, there are lots of things that we did and that showed great leadership in us. And that's how that leadership, the great leadership skills in the Federation for the Uganda Medical Association, opened doors for me to now enter the Doctors Association.
Wow, that's quite good. Well, our viewers, that is Dr. Faith Nabushawo from Mbale, though she
Bududa,
Bududa
please.
actually.
I'm from Bududa.
Bududa. Okay. So is it far from, is Mbale, is Bududa far from Mbale?
Actually, it was one district, Mbale, but these divisions created Bududa. Now
okay.
I'm in Bududa.
Well, yeah, she's from Bududa district. She's going to share with us the kind of Uganda that she envisions. And of course, Doctor, my question to you would be, how can we achieve a health sector free from unending strikes?
Thank you so much. Before we talk about the unending strikes, I think that it's good that we first look at the root cause of this. What is leading to these unending strikes? We hear is the nurses striking. After the nurses, it's now the doctors. Then the doctors, it's the interns. Interns are striking every year. You know, we see interns go on strike over the same reasons. So where is
and the latest, I think, the specialists, as you call them,
the latest, as we speak now, the senior house officers, that is the doctors undergoing their specialist training as they work. They are studying as they work. As I speak now, they lay down their tools, and over really the same issues that keep occurring. The same reason interns went on strike, the same reason doctors keep going on strike are the same reasons. Why is it that we can't have a solution to all these problems and have all this issue of strike end?
Yeah, I know you're going to talk about the solution. Yeah, so brief me about the root cause of these unending strikes.
The root cause of this should be the continued neglect of the health sector. And this whole thing starts with planning at the planning level. If there is poor planning, there is going to be all these things happening. Because if doctors, people will go on strike, they are really not just going on strike because it has become a habit or they really so much want it, but because there are issues they are tabling up for discussion and get solutions for, so they can go back to work.
Yeah.
But
so, doctor, is this planning from, because I want to understand, is this poor planning, is it from the government, from the health sector, from
the ministry?
From the ministry? Like, who is not planning well?
I see the problem coming from our mother ministry. That is the Ministry of Health. That's the Ministry of Health. If you have health workers going on strike, they are responsible for the planning. They have a planning committee at the ministry that has to do with the planning, foresee events, and make sure they plan appropriately. Also the lawmakers, because also Ministry of Health does not entirely work alone. The lawmakers, Parliament sits and allocates budgets, a particular portion to the health sector. There has been a continued neglect of the health sector, especially at the budget allocation. And I think the funding to the ministry receives is not enough. And something has to be done to correct this.
Well, I want to really understand, because if you say that what they give you is not enough, let's look into the budget allocation for the health sector this financial year that is ongoing. The government allocated 3.722 trillion for the health care for this financial year. And in their allocation, in the government's allocation, in the health sector, they looked at the 5 sectors, which is National Medical Store was given 597 billion for supply and the delivery of health supplies. The Ministry of Health that you said their planning is not so good when it comes to dealing with you and fighting these strikes. They gave the Ministry of Health 316 billion. The Uganda Cancer Institute, they gave them 66 billion, and Molago Hospital Complex 62 billion. So you're saying that this is not enough?
Yeah, looking at you're talking of the 3.7 trillion shillings, that is actually only about 8.5 or 8.7% of the entire national budget. In my opinion, I feel that that is not enough because they've been receiving that amount, and it has the problems that we do experience in the health system have continued to occur. That should click that we need an increase in the budget for the health sector.
Okay, so if there is an increase, you're saying that probably these unending strikes will end?
Yeah, we hope that it will end, but it goes beyond just having an increase in the budget. Because as I speak today, in the over 60% of the approved posts in the public service in the public service in the hospital, over 60% posts are vacant. And yet we see money being returned to the treasury every year, money that is supposed to pay health workers. So we really still have a problem at every level. How can you have a less workforce and then you're returning money to the treasury at the end of the year, which was supposed to have taken care of all these things? So at the end of the day, it all goes back to the planning. There has to be planning, proper planning from the head to the toe. You get?
Okay, just imagine you happen to be on the planning committee. What are some of the things? Because we are looking at the Uganda that we want to achieve when it comes to the health sector. If it happens and you're on that planning committee, Dr. Faith has been appointed to be one of the planning committees on the health sector. What are some of the things that when you're planning, you're going to say, let's plan this and this and this?
Well, because for me, the Uganda that I really want to see is the Uganda where people are happy, they are healthy, they are prosperous and wealthy. So if let's say I'm on that planning committee, I would have to work with all the various ministries. For example, if we are planning for health, you know that when you're planning for health, there are other ministries that you have to work with. There is the Ministry of Finance, the Ministry of Health itself, Education. They are all levels. Work together with all the other stakeholders and make sure that whatever is being done for the health sector is for the best of the sector.
Yeah, someone wrote a few years ago about the health sector, and he was talking about the major challenges facing the health sector in Uganda. I actually even saw an article published by the World Health Organization, I think in 2018 or either 2017 or 2018. And one of the things that he was talking about is the insufficient health spending. You're in the health sector. How do we see the insufficient health spending?
Now that one is seen at the chronic lack of supplies in the hospitals. You know, there is no time you'll be in a public facility and not have to send a patient to go and buy a list of things before they can be helped. You write for a patient a prescription and you tell them this is not there, you will have to go and buy it outside. Yet that is not supposed to be the case. They've come to a public hospital. Most of the people that come for services at these hospitals are the Ugandans that really can't afford. Now, I've come to the hospital, you've given me a prescription and you've told me to go and buy these things. At the end of the day, I'm going to carry my paper and go back home without this. You get? So the chronic lack of supplies in the hospitals, in the public hospitals, is a very big problem, and there has to be an increase in the budget for. That's why there has to be an increase in the budget for the health sector to have some of these problems sorted, because it is really disturbing for a patient to come to the hospital in the wee hours of the night. You know, emergencies don't know whether it's night or it's late. You know, and then they are here. You can't really give them the best care because the things are not there and they have to go and buy them. You get? So I think the problem of chronic lack of supplies is a very huge one in the health sector.
Yeah, well, I brought in that because I'm trying to think, why wouldn't we see you doctors striking more for that, but we see you striking more for low salaries? The president had to come on air to speak in 2017 and in 2021 about increasing your salaries, which I think he did. Some of you doctors, in some sectors, you are enjoying the money because of striking for salaries, and so I'm like, why wouldn't we have strikes that are talking about the insufficient health spending and
supply? To correct you on that, whenever we go on strike, the public might perceive it as we are all going on strike because we want better pay, we are being greedy, it's just about us. But that's not true. Each time we go on strike, whenever you read or follow us, if you follow us attentively, we are always asking, let there be supplies. Let there be enough PPEs. Because when I ask for PPEs, I'm also concerned about, when you come to me and there are no PPE, there are not enough PPEs. I'm just trying to see gloves, where I can find gloves, Whenever we are going on strike, there are lots of things that we are demanding and asking government to look through and have them provided. That includes the PPEs. We are saying government should provide for us PPEs. We are saying government, we are tired of the frustration of being in a hospital and you really want to help and see people improve and go home happy, but you can't because of this chronic lack of equipment. We are also saying, give us we need improved welfare for the doctors themselves, because a doctor who is thinking of the landlord at home, the landlord is demanding, you don't know how you're going to pay them, and then you're a doctor, that doctor is not very safe for anyone. You get. So whatever we do, whenever we lay down tools, it is beyond just personal gains as individuals, as doctors, but it also cuts across and goes down to everyone. Yeah,
probably when I say it, the viewers may not really get it so clearly, but when you say it, I believe they will understand what you're saying. So when doctors go on strike, what are the repercussions?
Wow. Whenever doctors go on strike, of course, there's a lot of damage that can happen, actually happens. Doctors who are supposed to be, manning these emergency centers or the wards or the OPDs, at the end of the day, you come to the hospital and you will not find them there. So at the end of the day, whenever doctors are on strike, it is that the Ugandan that has to pay dearly for it. How? By going to the hospital and not finding the service that you went for. The people that were supposed to help you out are home. They're asking government, please look through our issues and let's go back before we can go back to work. So at the end of the day, the fellow Ugandans really pay heavily. That's why as health workers, before we lay down tools, by the way, so that we just wake up from our bed and say, oh, today we are laying down tools. We first actually do a lot of negotiations. We write to various offices. And we get to a point where we're like, okay, I think this is the only thing that we've got to do. But that shouldn't be. I really believe that we can have issues solved by dialogue. I prefer that mode than, having to have people first strike before you can listen to them. And, it always causes a lot of damage.
Yeah. You've talked about a dialogue. And I'm as well thinking from the other side. Why would you as well strike and not go for dialogue? You keep working as you're dialoguing about the salaries and so on, than, bringing in what we've just talked about, that when you let down the tools, it is me, a Ugandan, who actually pay for it.
Because, like I just mentioned that by the time we lay down tools, we've tried dialogue. I think, let me put it that way.
Okay.
You try dialogue, you try writing, you try doing all the things, you know, you want to have these things. So because we are adults, we are landy people, we also understand the impact of a strike on the population. So we really, it's not something we always want to go for. It's like our last resort. We've been pushed to this, and now we just have to strike to be heard. Perhaps, maybe when we lay down our tools, we will be heard. It's just a desperate move.
Well, Doctor, is that really the Uganda that we should, you know, live in, whereby the leaders to listen, people must pull down their tools? Is that the Uganda that really we should live in?
That is not the Uganda I want.
Way forward, how can we deal with that?
Let's learn to listen to one another.
That is the leaders and those that they are leading.
Yes, the leaders and those that they are leading. Listen to each other. If someone is telling you something concerning the health sector, they are writing to you, they are explaining, endeavoring so much. I think it's good for us to employ dialogue and have issues discussed in boardrooms and sorted. But the problem is you'll go and discuss in the boardroom and decisions are made in the boardroom, but then there is no follow-up. For example, we had a very fruitful discussions several times with several officers, but at the end of the day, after the dialogue, you promise something, you go and, you know, work on that hope, on that promise, and then at the end of the day, it's not going as you agreed. So I think that let our leaders, if our leaders can only employ this dialogue thing, say what they mean and mean what they say, this whole issue will be sorted.
Yeah, but Doctor, okay, now you have a leader who doesn't mean what he says. What can we do? Because if I come to you and I have, I have a disease, probably you prescribe for me the medicine, you tell me, okay, if it persists, come back and we do this. Now we have leaders who don't mean what they say. What can we do to such leaders? Actually,
they are a very great problem to our nation, Uganda.
Yeah.
I personally love Uganda so much, and I am happy to be here. But there are people who really make you feel like this place is not
your country.
It shouldn't be the place to be. Leaders that are not living what they preach. That's why we see these corruption scandals eating up our country. I feel that the Uganda that I really want this Uganda whereby the law can protect each and everyone regardless of their backgrounds, rich or poor, young or small, big or whatever. But until we get to that point, we cannot get rid of some of these leaders, because we have people who are above the law. That is not a secret. There are
in Uganda,
yes,
Doctor, are you the one saying
that?
Yes. We have people who are above the law.
Who are above the law. They can do things and get away with them after all. So until we deal with that and make the law so strong and effective that it actually protects the people, and everyone has to submit to it.
Yeah. Well, we have the law, and some countries actually praise our law, our constitution. But still, I'm yet to find out and to understand why is it that the law that other countries are praising, the law that we have that other countries are praising, we are not living it. We are not implementing it.
There is a big problem at implementation. You know, there is saying, I'm going to do this, will be like this, should this happen like this, this will be the repercussion. And until you implement it, it's just mere talk.
So that take us back to leaders who don't mean what they say.
Yeah, for example, we had a very fruitful discussion, like I mentioned, with our president about a year ago when we interned lay down tools. Like, he gave us a very great audience. And we, in our discussions with him, he gave solutions to these things that we had presented to him. For example, he said there should be a task force to follow up the implementation of those plans and decisions that had been taken, but nothing has been done in that line. You get, so the problem is really, is it the implementers or someone saying something when he doesn't really mean it?
Because like now in your line, in your where you're doing your carrying your career and so on, is in health. When you speak to the president, I expect the minister in charge of health to mean what she says, or to implement what the president has said.
Yes.
So should we say that some of our leaders deliberately or intentionally refuse to implement what the president or the government has said?
I really have no authority to say, but what happens really says it all. If the president says this, let's have these people's issues sorted like this, give them this, and then they don't get it, and then they have to again go and lay down tools, do a lot of things to have it done. Really, it shows a very big problem. There are gaps maybe in communication.
On 8th December 2021, you appeared, and with your team, you appeared in Parliament.
Yes,
and I remember
November.
It could be November or December.
Yeah, December.
You appeared in Parliament, and I remember you saying that some of the intern doctors are subjected to working long hours, and they no longer receive pay. So when we talk about implementation, who implements this? Just a simple example. Let's start from there.
The implementation, because if it has to do with payment, we know that monies come from the Ministry of Finance. But Ministry of Finance doesn't pay you because it's not like our employers. I'm using an instance of interns. It's not the one that is employing you or deploying you. So the Ministry of Finance has to get the money to the Ministry of Health and let the Ministry of Health dispatch it to the rightful owners. That should be the issue. Now, I don't know where the gap now happens in between the ministries.
Yeah. Is there money that comes from the Ministry of Finance to the Ministry of Health, and somehow that money gets legs or tires or flies?
No, that's something I cannot really. I really refuse to comment on that because I don't have the authority to make any comment on that. But all I know is that this issue of the people going on strike because of payment, especially interns, this is about the interns and these SHOs, the senior house officers that are currently laying down tools. It could be sorted if we had an internship policy and an SHO policy, have these people added to the public service structure and have them receive their money as a salary. That would solve all this thing of, having to, go down on strike and then if they can just have a policy and have them included in the public service structure, this whole thing will be sorted.
And this policy can be formulated by the Ministry of Health?
The Ministry of Health, of course, with consultation from the stakeholders, and we have a policy. We don't have one. So we are asking, can we have just a policy? Have people add these interns, SHOs added to the public service structure. This would do us a great deal, actually.
Like the way it is in other sectors, that we see corruption in different sectors of this country. Is there corruption in the Ministry of Health, Doctor?
For sure, I cannot answer that. I cannot say yes, there is corruption in the Ministry of Health, or no, there is no corruption in the Ministry of Health. But we see as a country, the corruption as a vice is really eating up the country generally. It's a very serious issue eating up this country. You can see it at the local government service commission. A lot of things happening there. People have to pay money to get these recruitments, it's never actually free. That they are going to advertise and then you just apply and then you do the interview and then you go through. No, there is a lot of corruption. Look at the distance of this most recent iron sheet bonanza. These are key stakeholders. These are leaders that everyone looks up to. And when you hear things like they are involved in this, iron sheet bonanza, I get surprised. So corruption has to be dealt with right from the topmost positions. If the leaders in those positions are doing this, how much more will the others do? So corruption generally as a vice, it's a big one and it has to be dealt with.
Yeah, we have organizations, we have units like anti-corruption unit, the Inspectorate of Government. We also have NGOs that are trying to advocate for a corruption-free Uganda, but still, it seems there's something that we are not doing. I don't know if you know that there's something different that we can do to have a corruption-free Uganda.
Something can actually done. Actually, for us to have a Uganda that we all want, that everyone desires, is not a dream that is unrealistic or unachievable. No, it's something achievable. There are solutions, definite solutions to all these problems. They're there. But the thing is, the people to implement this seem not to be interested anyway. They just seem not to be interested because they think the solutions are there. If you find a corrupt fellow, deal with them and let others learn that, should you do this, this is going to happen to you. But now we hear things of corruption, they just show up in the news, and then before you know it, it's no longer they talk, and we move on to, you get. So I think that...
recently we had the NSSF stuff. And then the ANSHIs came in, and then we were like, people were actually trying to get away from the NSSF. And we are talking about the taxpayers' money. We are talking about the workers' money, So you work and you save your money in the NSSF, and you think that these leaders are supposed to keep my money safe.
Oh, beyond just having the thing, one person deal with some of these vices, I think it's the responsibility of each one of us, everyone, every Ugandan. It's our responsibility to help in the fight against some of these things, because if you know very well that you're genuine, you really qualify for that job, and someone is putting you in the corner and is asking you for something, what happens if we all refuse to, give in that kitu kidogo? Will the person really keep it? No. I think it comes down to each one of us. Let everyone know their rights and really own that.
But there's someone, doctor, who squeezes you in the corner and you're like,
and you're like, you're desperate, this is the only opportunity that has presented to you, and you're like, man, maybe I should just better, sort this person again. But I think that now, when we keep doing that, we are promoting, actually, I say we are promoting the what? The vices. You make them comfortable knowing that, yes, they can continue doing that. After all, they get away with it. And you actually, it's us that are helping them continue with that. That is wrong.
Yeah, I had someone suggesting that to my friends in the police, like the traffic officers. They're like, okay. Actually, I was with Afande Farida, and she told me, and she said, you who are accusing my Afandes that they take money out of you give them bribe and they accept. Why don't you record that that Afande who is taking money from you, and you send us the video. Why that you don't do so?
Let me tell you, these guys are also, they have mastered the art of the business, of course. They will know when someone is suspicious and, you know, but I think it has to be upon us to make sure that if you're caught in this thing, in this situation, provide evidence. Make sure that you collect evidence and have these people dealt with by the law.
Still, the law comes in.
Still, the law comes in.
Well, away from you know, the strikes, having a dialogue, the insufficient funding, the health sector, what else do you see that really needs to change in our health system so that Ugandans can enjoy the health sector?
The increase, I think there is great need for increase in the staffing gap.
There is understaffing.
There is understaffing, which is a very big problem. That's why you see people, someone comes in the morning, they know that anytime they are going to the hospital, they have to spend the whole day. That's because of the understaffing. Like I mentioned earlier,
that still due to poor planning?
Poor planning, low funding, a lot of things come in. Though they too. Poor planning and funding, that has to be coming in. So the understaffing affects the Ugandans in that you go to the hospital and then you have to wait long lines because the work that's supposed to be done by 6 doctors is being done by 2. You get, and now it results into all that. And at the end of the day, if you, let's say you have an emergency among those that are waiting, and then you have to see the 100, the burnout for the doctor, that is one can make the doctor make the mistake. And also the long waiting can greatly affect those that are waiting.
So
there has to be, let there be increased in the staffing. Let them reduce, let there be a reduction in the staffing gap. Fill all the vacant positions in the health sector and make it easy for the work to be done much more easily and for the benefit of the population.
Do we have a permanent secretary in the Ministry of Health?
Yes.
What does he or she do? Or what does he or she supposed to do when all this is happening? Like looking at the post, not the person, but looking at the position of a PS. What does he or she supposed to do? Just looking at not the person, but the position.
She's supposed to actually, because she's our employer, she's supposed to be aware of all these things that are happening, and I know she knows. She's supposed to, you know, take care of the day-to-day business at in the ministry, in the health sector, and of course liaise with the other peoples that are concerned to ensure that there is an improvement, there is improved health care and healthcare delivery in the country.
So still, if I recall very well what you said when it comes to some of our leaders, that we intentionally somehow refuse to implement what we are supposed to implement when we know we are supposed to do so. And I don't think that's the Uganda that we really want. Well, away from the health sector, which other Uganda, as a doctor, would you want to see?
I want to see a Uganda that, like I mentioned, I want to see a Uganda where people are happy, they are prosperous, they are wealthy, and
happy. What do you mean? What brings happiness?
Unfortunately, that's not the case today. We have very many Ugandans living below the poverty line, and this number keeps increasing by the day.
So what went wrong, and how? Because you said achieving the Uganda want is very possible, it's very realistic. Like we can achieve it. So what went wrong to see that many of our Ugandans are living below the poverty line?
That one can go to the planning. the fair distribution, equitable. There has to be equitable distribution of resources in all regions of the country. Let there be justice, that we have resources equally or equitably distributed in all the regions of the country, that all the population can benefit. You get, not having other places doing so well there, and then the other regions, you go to the north, bad news. Very many people living below the poverty line.
Okay. Then the other Uganda, that one is solved, okay. The government should think about that. And that goes probably to the planning. Also, we have the National Planning Authority.
The other Uganda I want to see is Uganda where people are well educated. They have access to education, good education.
Yeah, you've reminded me. The president was in South Africa, and he said that he first of all thanked ANC for educating South Africans. But then he said, okay, in Uganda we are trying, but there are some people who are increasing the fees and so on and making it hard to educate Ugandans. I just brought in that just to interject in what you're saying. So how can we achieve that?
First, we have to make it affordable.
Yeah, we have UPE. We have UCE and USCE.
There has to be, I think there's a very great problem that side. And that's
what is that problem? Because if you don't tell us that problem, then we will not know the problem. What is the problem that is in the government schools?
Wow, that is that's something that I really don't want to go into, as it's not my best. But we know that there is a very huge problem. We know how our UPE schools really look, and the training there. They also have issues, the same issues we have in the hospital, public hospital. They are the same issues they basically also face. The funding, the understaffing, the infrastructure and everything.
Yeah, if we are to, me and you, okay, this is between me and you, if we are to compare the quality of education that is being given by the public and the private, would you say the quality of education from the public sector is kawa?
Is better.
How about the one from the private sector?
Hey, by the way, I've benefited from UPE. Let me not I've benefited from UPE. My primary school was a UPE. So
okay.
Yeah,
then how about the secondary school?
No, it was private.
Why?
It was private.
Because this is something that we have to think about, and leaders have to know. If there are leaders who intentionally think that they should not implement something in education, they have to hear it and they do something. Because you're saying you want a Uganda where Ugandans are educated, well educated.
Yes.
So, okay, so you're saying that the quality of education in public schools is better. But why is that people, parents don't want to take their students in there?
People have their own various reasons, but I think they also look at what happens there. You see some schools in my village where, there is really hardly any order in the place. Students go there whenever they want. Then the other day they are not going there, and there is really something that really
and that's a big problem, Doctor, because these teachers, well, they also have their strikes and so on, but this is the impression. These teachers are paid.
Yes.
By my money, me the taxpayer.
Yes.
Why don't you go and teach? And if it's what you really wanted to do in your life, why don't you go and teach? Why don't you go and serve in that health sector and many other sectors? These are something that really needs to be thought about.
Yeah, sometimes it has to do with motivation. We've seen also teachers go on strike because of
Lack of motivation?
Poor, no, poor facilitation.
Okay.
Yeah.
Finally, okay, this is Lynn. She's in Kisasi. She said that generally it's true. The point is about every Ugandan. We act irresponsibly to the extent that even those not in leadership support corruption in one way or the other. In fact, it's about me and you. Otherwise, Ugandans enjoy talking about action in all sectors. We lack love for our country. It can only take committed individuals to change such situations. Thank you, Lynn, for following us from Kisasi and for your comment. Well, Doctor, you have 1 minute to summarize the kind of Uganda that you want to see, that you envision, and you will be out of this place.
Thank you very much once again for hosting me. And to our viewers, I want to say thank you for following us, Dream TV. One thing that I forgot to mention in my introduction that I feel I should say is I am born again Christian and I love Jesus for what he's done for me. Finally, in my conclusion, the Uganda that I want to see is a Uganda where there is no corruption, there is justice, human rights, the basic human rights and freedoms are preserved, protected and respected, and also a Uganda where there is everyone is healthy and wealthy, where health services can be accessed by everyone, regardless of our various backgrounds. That is all. And above all, I would love to see a Uganda that that considers the word of God as supreme. And that is just in line with our motto, for God and my country.
Well, you've heard it from Dr. Faith Nabushawo from Bududa district, sharing with us the kind of Uganda that she envisions. You as a Ugandan, what are you going to do to make sure that you achieve the kind of Uganda that you want? My name is Mulanzi Robert. We sign out for now. Bye-bye.